There are a lot of questions out there about Medicare coverage. It can be pretty confusing. We're here today to answer some of those questions and help you figure out what kind of coverage is right for you. So sit back and get ready to learn more about Medicare. Let's get started. First things first, what exactly is Medicare? Medicare began through an act of Congress in 1965, and today more than 46 million people participate in the program. Medicare was designed to help people, especially individuals 65 and over, pay for the rising costs of medical care. Medicare has changed a lot since it began. New parts have been added, and options are now available so you can pick the plan that is right for you. You can enroll in Original Medicare during the period of 3 months before the month of your 65th birthday, the month of your 65th birthday, and up to 3 months after the month of your 65th birthday. And you can enroll in Medicare even if you have pre-existing conditions. To understand how Medicare works, you need to first understand the different parts that are offered. These parts are Medicare A, B, C, and D. We'll start with Part A and Part B, since those are the parts offered by the government directly. Together, these parts are known as Original Medicare. Keep in mind, as we talk about what is covered, that Original Medicare isn't designed to cover all your healthcare costs. Part A helps cover the bigger issues like inpatient care and overnight stays at a hospital, as well as skilled nursing facilities, hospice care, and home health care. It's available to most people at no cost, but it does have limits on the number of days it pays for and requires you to pay a share of the costs, and that can get really expensive. But there are ways to supplement this basic coverage, and we'll get back to that later. Since you'll need more than just hospital coverage, Medicare also offers Part B. You do pay premiums or monthly costs for Part B. It provides coverage for more common everyday expenses, things like doctor's office visits, x-rays, and blood work. However, Part B can also leave you with out-of-pocket expenses because of things like deductibles and co-insurance. That means that you share the cost for many services. Next, we'll talk about Part C, which is actually designed to replace Part A and Part B. Part C is also known as Medicare Advantage. These plans, like an HMO or PPO, are another Medicare health plan choice. Offered by private companies that have a contract with the government, Medicare Advantage plans provide all of your Part A hospital insurance and Part B medical insurance coverage. These plans may offer extra coverage, such as vision, hearing, dental, and/or health and wellness programs. Most include Medicare prescription drug coverage plans, known as Part D, as part of the premium. Speaking of Part D plans are offered by health plans and other private companies to help you pay for generic and brand name medications. Most Part D plans require you to pay a monthly premium, plus a share of the cost for your prescriptions. These plans vary by the drugs they cover, how much you pay in monthly premiums, and for your share of the cost of drugs, and which pharmacies you can use. Part D is offered as a standalone plan, which can be added onto your existing coverage or included as part of a Medicare Advantage plan, Part C. So we've talked a little bit about the parts of Medicare, and it does seem like there are a lot of gaps in what is covered, right? For most people, traditional Medicare alone just isn't enough coverage. So how do you protect yourself and reduce your risk of high out-of-pocket expenses not covered by Original Medicare? That's where a Medicare supplement plan comes in. To enroll in a Medicare supplement plan, you must first enroll in Part A and Part B. Then your Medicare supplement plan will help pay your share of the costs for covered services by filling in the gaps in Medicare Part A and Part B. To help you compare your plan options quickly and easily, here's a chart that summarizes what we've talked about. Part A. What is covered? Covers a share of expenses associated with hospital, skilled nursing facilities, hospice, and home health care services. What isn't covered? You pay a share of the cost because of things like day limits, deductibles, co-insurance. Part B. What is covered? Covers a share of expenses for doctor's visits, outpatient surgery, labs, and x-rays. What isn't covered? Doesn't cover deductibles, copays, and coinsurance. Part C. What is covered? Medicare Advantage plans cover both hospital care and things like doctor's office visits, x-rays, labs, etc. Sometimes Medicare Advantage plans also cover prescription drugs. What isn't covered? Some plans won't cover out-of-network expenses and specialist visits without a referral. Medicare Advantage plans also require cost sharing such as coinsurance, copays, and deductibles. Part D. What is covered? Generic and brand name drugs. What isn't covered? Not all plans have the same formulary, the list of covered drugs, and you will need to use a network pharmacy to ensure your drugs are covered. Medicare supplement plans. What is covered? Depending on the plan, your share of costs for services partially covered by Part A and Part B. These are things that require out-of-pocket expenses like coinsurance, deductibles, etc. What isn't covered? Most other costs not covered by Medicare. If you decide to go with a plan provided by a private insurance company, whether it's Part C, Part D, or a Medicare supplement plan, there are some things you should know. A lot of the benefits covered by these plans are required by Medicare, so they are pretty similar. That means that you'll want to think about some of the advantages of one company over another. These might be reputation and reliability, customer service, cost, network,